Thank you for joining my presentation on coronavirus COVID-19, what to do if your child is sick. My name is Terence Shenfield, and I am the co-owner of A&T Respiratory Lectures, and I hope that you really enjoy this program because you're going to learn a lot throughout it. Since the beginning of the COVID-19 pandemic, there is approximately 13 million children who have been diagnosed being positive for COVID. They represent approximately 19% of the population here in the United States. Recently, the Omicron variant has shown that there's been over 1 million cases reported in just 1 week. So the fact that children are susceptible to getting COVID is very real. Do they get sick? Yes. Do they get as sick as adults? Not really. But I wanted to go over some of the details of how children get sick, the signs and symptoms. I'm also going to be talking about the fact that some children get really sick and are hospitalized, and I don't want to sort of give away anything right now, but this is a very real thing, and you as a parent and me as a parent, we sometimes worry about our children. And the fact is, children go to school. Many are required to wear masks, but the likelihood of them actually getting COVID and maybe potentially spreading it within the household is very real. So sit back and let's enjoy this conversation we're going to do on COVID. In today's presentation, we will be reviewing the epidemiologic impacts of COVID-19 on the pediatric population. I'm going to discuss multi-system inflammatory syndrome in children, commonly known as MIS-C. You may have never heard of this, but there's a significant number of children who get COVID who end up getting this disorder called multi-system inflammatory syndrome. It also occurs in adults, but it also occurs in children. Some of the ongoing things going with that, basically it's an inflammatory disease where multiple organs in your body get inflamed, such as your heart, your lungs, your kidneys, your liver, everything gets inflamed. And they say that it's probably associated with getting the COVID virus. If your children has any of these symptoms, such as an ongoing fever, stomach pain, bloodshot eyes, diarrhea, dizziness, skin rashes, or vomiting, you may want to bring the child to the doctor to determine whether they have the MIS. Also, I'm going to describe the transmission of COVID-19 with children. I'm going to talk about how the signs and symptoms of COVID-19 in children occur and how they differ than adults. Then I'm going to talk about what is known as long COVID-19 with children. There's a term that's being used more often now. It's called long COVID. Long COVID occurs in both children and adults. Basically, what that means is you get a COVID infection and you have a prolonged recovery. In other words, it takes months to recover from it. They've done some studies where they've shown that almost, I would say, pretty close to children who are 16 years of age and under, almost 50% of them have long COVID in their recovery. So it takes more than 5 weeks of recovery. They still have symptoms after a long period of time. And this occurs with adults too, but it's basically, I'm going to cover long COVID with children. And then I'm going to talk about treatment options. I'm going to talk about vaccinations with children. I just recently visited some family members up in Canada, and they have some young children. And I was really surprised that almost 90% of all Canadian children are vaccinated. Kind of interesting. I don't know what the statistics are, but probably by the end of this presentation, I'm going to know some statistics here in the United States. So these are the objectives for today's presentation, and I will cover each one in detail. I have some questions for you. Should we be concerned with children getting COVID or not? Are children less susceptible to getting COVID, or do they don't get as sick as adults? Should we be concerned at all? Are children less likely to get COVID? Do they have a more intact immune system? Do they recover quickly? Do they not get sick at all? What exactly happens with children? How likely is it that a child infected with COVID will be asymptomatic? So what percentage of children who get infected with COVID-19 are symptomatic? So the question also is, if you happen to be asymptomatic, can you transfer the virus to someone else, say like an adult, which may not be that good? Are kids any more or less likely than adults to spread the coronavirus? So I'm talking about the fact that how long does the coronavirus shed with children versus adults? Is the shedding process the same? Is the likelihood of spreading it from one person to another the same with adults and children? Another very important question is, should we have our children vaccinated? I alluded to this earlier, that telling you that I visited some family members up in Canada, and I was really surprised after talking to a big group of them that most of the children in Canada, over 90% of them, are vaccinated. And I thought that was such a high number compared to US numbers. So my question to you, if you happen to have children, are they vaccinated or not? And if you could, please put that in the Zoom comments. Say, yes, my child is vaccinated, or say, no, my child is not vaccinated. Now, another question is, are COVID vaccine side effects the same in children as they are in adults? When I got my COVID vaccine, I got the Moderna vaccine, my only side effect was my arm hurt. I didn't get sick, I didn't get run down, I didn't feel feverish, I didn't have any kind of problems at all, except that my arm hurt for a day or two. And then when I got the booster, it was the same story, my arm hurt. But I've heard of many people having more serious side effects with the vaccine. And again, if you had any kind of side effect with the vaccine, can you please just put a comment in the Q&A, say, yeah, my side effect was this or that. Also, I've heard about a variant called the Omicron. How concerned should we be? You know, the coronavirus has mutated a couple of times and probably even more in the future. And how concerned should we be about different variants of this virus, especially with children? Now, another really important question is, I am sure most of us in this group have been vaccinated. And if not, I understand. We're having a whole conversation about healthcare workers not getting vaccinated. But if you are vaccinated, will this protect you against the new variants? Will you be sort of protected partially, fully against any kind of new variants that are coming up? Or do you have to constantly get a new booster on the type of virus it is? So these are some very important questions that are probably labored on everyone's mind, and we all want to know the answers to. And hopefully by the end of this presentation, I could answer most of these. And then at the end, we could also share an open dialogue, and you could give me your own experiences. I wanted to share with you some data on COVID-19 with children. And I have to say that the American Academy of Pediatrics and Children's Hospital of Philadelphia have worked together to collect data on national statistics. And this first slide talks about they started collecting data at the start of the COVID pandemic. And this report sort of is summarized up to March 24, 2022. Every day they come up with a new report. But as of March 24th, 49 states, including New York City, Washington, D.C., Puerto Rico, and Guam, provided information about COVID-19 cases. As you can see, New York, which is the one in yellow, actually started reporting data just from New York City, but not the state of New York. And certain states such as Alabama, Hawaii, and Washington, D.C., and Minnesota, they actually stopped sending data back in 2021 or late 2022. So, but everyone in purple has been collecting data and reporting data on a regular basis. And the next couple of slides are going to go a little bit more detail about what's going on. This slide more or less speaks to how COVID-19 is reported based on age limits. certain states define children at different ages. Like, for example, 0 to 14 is displayed in yellow, which is like Utah reported data like that. 0 to 17, which is light green, or like Georgia, Oregon, and so on like that. 0 to 18 is dark green, and 0 to 19 is like a teal color, and 0 to 20. So the problem here is that different states report children based on different age categories, which is kind of crazy. You know, I think everyone should report children 0 to 17 rather than 0 to 14 or 0 to 19, because it sort of skews the data. Why we don't have one consistent age for children across America, who knows? But the bottom line, I just wanted to share this slide with you. Not too much relative, but maybe it is if you think about the states that reported in yellow, like Florida, only reported children 0 to 14, and you know that's the only state across the nation that did it. As we review this slide, this is the cumulative number of child COVID-19 cases reported. And as of March 24th, there was approximately 12,813,648 cases being reported across America. 3 of those states reported less than 30,000 cases. 9 states reported over 400,000 cases. And as you could see, California, Florida, Illinois, Pennsylvania, Ohio, North Carolina were the top of the list. Now, you have to remember that the population of children in each state varies. Like California is the biggest state in the nation, so you would expect that they would have the most amount of cases. My next slide is going to be talking about per 100,000, which I'll get a little bit more detail on that. But as you can see, some states were hit hard, but it could be kind of skewed because it's based on population. And some states had hardly any cases, and they did pretty good. But the next slide is going to speak volumes about the actual data. This is a much more interesting slide because what it does is cumulative COVID-19 cases per 100,000 children. So basically, what they were doing is estimating the number of cases of COVID based upon 100,000 children. So this sort of equalizes, you know, if like say California has the most amount of children of any state across the nation, but it really looks at how many cases of reported COVID there were. And it was used, they used the Census Bureau data from 2019. On an average, over 17,000 COVID-19 cases were reported per 100,000 children in the population. 16 states reported more than 22,000 cases per 100,000. One thing you have to think about is the fact that some states were not really testing children effectively. Like, you know, maybe, for example, Rhode Island, as you can see on the top, had the highest amount of cases of COVID-19 in children of any other state across the nation. But the question is, are they doing more testing? Are they testing more children? Are the parents more involved about getting their children tested? Or are these children getting more sick? So states that were leading the total number of cases of COVID in children were Rhode Island, Arkansas, West Virginia, New Hampshire, South Carolina, Tennessee, Kentucky, and so on. And then states like Alabama, you know, had the lowest reported levels. But like I said, maybe the people in Alabama, the parents, were not getting their children tested as much. And, you know, so, you know, we know certain states got hit really hard, but this is a pretty good chart showing how many cases of COVID were reported per 100,000. And you can see that some states had higher levels than others. So this is a very important slide because basically it's showing that children do die of COVID-19. So they looked at data from 5/21/2020 to 3/24/2022, and they looked at the total number of deaths of all ages as compared to children. So, for example, in January 27, 2022, there were approximately 805,000 deaths, of which 807 were children. Then, based on March 24, 2022 data, there was approximately 892,750 total deaths, of which 952 were children. So you could see month by month, more children have died of COVID. So don't think that children don't die of COVID. They do. And this is actually a percentage of that right here, which, it's pretty consistent across the board. Almost like 10, 11% of all COVID deaths are children. So we're going to get a little bit more detail. I just wanted to sort of give you a little bit of background data on how many people are dying, how many people have it, and we're going to get a little bit more into it as we go along. This is another very interesting slide. Basically, the World Health Organization reported data from December 2009 to September 2021, and they were looking at the total number of cases of death amongst children. And they found that different age groups have different percentage of mortality. For example, if you are under the age of 5, the likelihood of you dying is like 1.8% of all cases. If you were age 5 to 14, the likelihood of death, the number of reported deaths was 6.2% of the cases. And if you were 15 to 24 years of age, the likelihood or the percentage of cases of mortality were 14.3%. But the most interesting point of this, you notice as they get a little bit older, as children become young adults and adolescents, it increases the likelihood of mortality if you happen to have COVID-19. If you're less than 5 years of age, you have less than a 2% chance of dying, and that's what's been reported by the World Health Organization. But very interesting that as you progress in age, the likelihood of mortality is increased in the total number of cases. So we all know the reason for that, ACE receptors and all these things going along with that. So let's talk about the symptoms of COVID-19 with children and adolescents, how it differs than that with adults. Many children get COVID and are asymptomatic, and they're trying to figure out why is this happening. A lot of times children have a different immune system. Their adaptive and innate immune system is different than adults. They also have been subjected to recurrent infections as children. Think of RSV infections, colds, and so on. And as a result, they build up some type of immunity. Studies also have shown that children have a better microflora of their intestines, which has to do with immunity. So all of these factors result in less symptoms with children than adults. Problem with children, as I mentioned before, some children who get COVID also get what is known as multisystem inflammatory syndrome, or they call it pediatric inflammatory multisystem syndrome. And both of these are associated with having a COVID infection. It's very rare, and we're going to talk a little bit about that a little bit later, but I just wanted to give you a little starting point of why the symptoms with children are milder, and we're going to get a little bit more detail as we go along. Let's talk about disease severity in children. They have different categories. For example, a child that's considered asymptomatic is positive for COVID using a test, but they have no symptoms consistent with COVID-19. So that is asymptomatic. They have another category called mild illness. Mild illness is defined as signs and symptoms of COVID, but no shortness of breath, no dyspnea, and no abnormal chest x-ray. Then they have the category of moderate illness. Moderate illness are signs and symptoms of a lower respiratory infection or abnormal imaging, but their SATs are greater than 94% on room air. So the key point there, they have symptoms, but their SATs are still greater than 94%, 94 or greater. Then you get into severe categories. One is called severe illness. Severe illness is their SATs are less than 94% on room air. Their PF ratio is less than 300, which is the same as acute lung injury. Their respiratory rate is greater than 30 breaths per minute, and they may have lung infiltrates of a greater percent of 50% or greater of their lung fields. Finally, we get to what is known as critical illness. Critical illness is respiratory failure, probably they need to be intubated, septic shock, or multiple organ dysfunction, like we're going to get into a little bit later. I'm going to tell you about that. So they did a study, and they looked at about 2,143 children diagnosed with clinically diagnosed COVID-19, and they found of those 2,143 children who were diagnosed, over 90% of them were asymptomatic or mild or moderate disease. So basically, all of their SATs were greater than 94%. They might have had some symptoms, but very mild. But about 5.2% of that group had severe illness, like I mentioned before, what is severe illness, and about 0.6% had critical disease, probably requiring intubation. So these are some severity guidelines to go by. So when we talk about asymptomatic, or we're talking about mild illness or moderate illness or critical illness, you have a better understanding what it means. You may be asking, why is the COVID virus or the SARS-CoV-2 virus milder in children? Why do children don't get as sick as adults? Why are they asymptomatic? What's going on? What's different with them? And the number one reason I'm going to tell you. First of all, the COVID virus invades human cells. And the most common way that the virus enters the body is through the nose. So when a patient breathes in the virus through their nose, inside the nose of children, adults, everybody are what they call ACE2 receptors. And they have found that these ACE2 receptors in the children's nose are not as pronounced as they are with adults. So in adults, we have ACE2 receptors in our nasal passages, we have it in our airways, we have it in the lower airways, the upper airways, and we have a lot of them, a lot of ACE2 receptors. Also diabetics, people who are obese, have a lot of ACE2 receptors. But the good news is children don't. Children don't have a lot of these ACE2 receptors. So what happens is the virus's S protein binds to the host cell's angiotensin converting enzyme, the ACE2 receptors, and actually this facilitates the attachment to the host membrane. So the whole problem why the virus doesn't impact the children as much is to those ACE2 receptors in the nose and in the lower airway. Also, children are susceptible to a host of different types of viruses, especially in the coronavirus family, such as RSV, such as colds. They get recurrent infections, so they build up some form of innate immunity to it. So, but the number one reason why they believe children don't get as sick as adults, it has to do with the ACE2 receptors that are found in the nasal passages, the upper airway and the lower airway, and these receptors are well pronounced in adults and even more well pronounced in adults with diabetes, hypertension, and so on. There's a whole series of conversation that we could have about ACE2 receptors, but I just wanted to give you the major reason why children have milder symptoms, and that is it. The virus doesn't replicate as much as it does with adults due to this very good reason. So as I was mentioning, the symptoms of COVID are much less with children than they are with adults. A lot of children, they are asymptomatic, like we were mentioning before, or they have mild to moderate disease. If you have symptoms, typically it's of an acute respiratory infection. You could have a fever, you could have a cough, a sore throat, sneezing, fatigue, and so on. Also, because children have smaller airways, they have less diameter airways, their radius of the airways is smaller, wheezing is kind of common. Other signs and symptoms with children, they can have diarrhea. About 8.8% of them show diarrhea. Fatigue is at about 7.6%. Rhinorrhea, which is basically runny nose, is about 7.6%. And some of them have GI problems such as vomiting. Around only about 2.3% showed a SAT less than 92%. So obviously, it doesn't impact them as much. And why? That ACE2 inhibitor, not ACE2 inhibitor, the ACE2 receptor sites in the nasal passages in the upper and lower airway is the problem. Other things that can happen, they could get tachypnic, about 28% of that. They get tachycardia, about 42%. But these are the patients who are basically admitted to the hospital. So the signs and symptoms of children with COVID is much less, but they are there. Let's further the conversation about signs with children with COVID. A lot of times with adults who were severely ill with COVID virus, they showed lymphopenia, which means low white blood count. So only 5.5% of the children actually showed a low white blood count who were symptomatic with COVID versus adults. Another thing, they found that elevated C-reactive protein levels were only found about 14% of the children. When you think about C-reactive proteins, think of inflammation. The higher level of inflammation, the higher level of C-reactive proteins, and this only occurred about 14% of the children. Also, patients, children who were symptomatic, 36% of them didn't show any kind of abnormality in their chest CAT scan. And also regarding x-rays, those who were severely ill or who were moderately ill, about 29% of them showed unilateral lesions, bilateral lesions, and ground glass opacity. Ground glass opacity is affiliated with the inflammatory process, very similar to ARDS. So I wanted to tell you more about multi-inflammatory syndrome in children and COVID. I mentioned it earlier, and this is something that is of concern. It's uncommon, but it can be very serious when it does happen. Statistically speaking, as of when I put this presentation together, they believe there's approximately 316 persons per 1 million who had a SARS infection will get MIS-C. Currently, as of March 2022, there were 7,459 cases, and of that, 48 deaths as a result of this. Basically, it's an inflammatory condition that normally takes place about 4 weeks after the infection, after you have a COVID infection. This is an example of a picture of a skin rash that is common with it. The initial symptoms include fever, rashes, red eyes, diarrhea, vomiting, and it gets worse over days. The problem is, after a certain period of time, after this rash and everything like that, what you have is this inflammatory process where the heart gets enlarged, blood vessels get enlarged, other organs get enlarged, and then that can be critical, and that's what really needs to be done. When kids have this, they need to be hospitalized, and yes, you can die from it, but the likelihood of dying is very low, and also the likelihood of getting it is very low. But it's uncommon, but it's kind of, they don't know exactly what's going on with it. You know, they know that someone has a COVID infection, a kid has a COVID infection, and then 4 weeks later, they start getting this. And so you got to be very aware of this. So I have a question for you. To what extent are children responsible for the transmission of the COVID virus? So you have children, they are asymptomatic. You hear that if they do get sick, they don't really get as sick as adults. So what kind of risk factor are they in the household? I mean, suppose you live with your mom and dad and they are a little bit elderly, or you live with someone else who's got, some kind of comorbidities. How risky is it with the children? And what they have found that children are minimally responsible for the transmission of the COVID virus in a home setting. And they have a term, what they call index cases. Index cases mean exactly where did the transmission of the virus start? Like, did it come from a child? Did it come from an adult? So whoever that person is called the index case. And they found that there's a low level of index cases from children who are in school, who participate in extracurricular activities around the school. So they really feel that they are not the major cause of infection in the household. But they did find that there were outbreaks when these adolescents attended camps, they went to sport events. So that is a possibility. They can transmit the virus just as well as an adult. They could harbor the virus and shed the virus just as well as adult. So you do got to be careful. But on the most part, they are not the leading cause of spreading the virus from one person to another, especially in a family setting. This is a little bit more about how young children can transmit the COVID virus, but they can be less infectious. What that means is typically children who get the COVID virus don't display any kind of symptomology. In other words, they are asymptomatic. So when you think about it, if they're asymptomatic, does that mean that they can't transmit the virus to someone else? And the answer is no, they can transmit the virus. There's a term called viral shedding or viral RNA shedding, and that basically means that as a virus multiplies in the body, especially in the respiratory tract, it could be expelled out of the lungs, and it could be brought in by an adult who breathes it in, and they could get sick. As I mentioned earlier, the primary reason why children get less sick is because of the ACE2 receptors in the lungs are not as well pronounced as they are for adults. They were also looking at children in school. So children in school typically are required to wear masks, and they have found some studies, most studies have shown that with these kind of precautions, it actually reduces the likelihood of getting COVID. And if they don't get COVID, they're not going to bring it home and spread it to family members. So I don't think from what I'm reading about the evidence that we should be overly concerned about children going to school with masks and, the likelihood them going to come back and transmit it to adults. But they also found that younger children, under the age of 5, there's a very, very low likelihood of them transmitting the virus to adults because they don't come in contact with a lot of people. But as children become adolescents, when they're 15, 16, 17, and they're hanging out with their friends, they are more likely to come in contact with someone who is sick, bring the virus at home, so you got to still watch. There's also a term of herd immunity. In other words, as more children get sick and they build up an immunity and they come in contact with other children who are sick, they're not going to get sick and they're not going to bring home any kind of viral infection to the family members. That's a little interesting. So you're a parent and your child has asthma, or maybe one of your family members has asthma. But since this presentation is more about children, let's talk about a child with a history of asthma, and you're worried about if they happen to get a COVID infection, what kind of impact can that have on them? Typically, we would always think of someone who's an asthmatic who gets a cold or a flu, they're going to have worse asthmatic symptoms. The funny part is that with COVID, it's the exact opposite. Many parents feared that their children may, get a COVID infection. They're also an asthmatic. Typically, the pathophysiology of asthma includes mucus hypersecretion. They get a lot of secretions. They get damaged epithelium, and they also get airway obstruction. The commonplace treatment for asthma, like moderate to severe asthma, is steroids, inhaled corticosteroids. But they have found that based upon the phenotype of the asthma, like what type of asthma you have, if you happen to have allergic asthma, which is very common, that results in increased eosinophil expression. And the funny part is, as you have increased eosinophil expression, you have less COVID-19 symptomology. So it actually works in your favor if you happen to have allergic asthma. Many of the children who are treated with corticosteroids, corticosteroids has been shown to attenuate or reduce the ACE2 receptors expression and therefore reduce symptomology. So the point is that if you happen to have a child with asthma and they happen to get a COVID infection, and they happen to be allergic asthma, and they're treated with corticosteroids, they actually might have less symptomology as compared to someone else with asthma. So the bottom line is, don't panic. It's not a bad thing at all. I mean, it's bad enough that they're sick. It's bad enough they got asthma. But the funny part is this works in the opposite way. So let's talk about the variants such as the Delta and the Omicron variant COVID virus. Should we be concerned with children? Is this making a difference? Well, one thing that's making a difference is the fact that many children are not vaccinated. And as a result, they can come in contact with these variant strains such as Delta and Omicron, and the likelihood of these strains spreading with children is greater than these other viruses. But the concern is it does not impact them as much. I mean, for all the reasons I mentioned earlier, even though they are more susceptible of getting the Delta or the Omicron variant, they are not getting sick or they are asymptomatic, but they can spread this with other people. The major concern is the children that are not vaccinated. I know there's a big push for children to get vaccinated, and a little bit later during this presentation, I am going to talk about vaccination with children. But currently, are these viruses spreading quicker with children? Yes. Are they more contagious? Yes. Are the kids getting severely sick? No. But the likelihood of them spreading the virus with someone else who is not a child is greater. So hopefully, as more and more people become vaccinated, and to a certain degree children will become vaccinated, it's something to be looked at, something to be concerned about. And we're going to be talking about children and vaccinations a little bit later, and stay tuned. There's a term called long COVID, and long COVID is both occurs in both adults and children, but there seem to be long COVID is predisposed with children who are greater than the age of 15. So what exactly is long COVID? Someone gets a COVID infection, and the problem is they have persistent symptoms after 6 months of initial diagnosis. So in other words, they don't get better quickly. This doesn't happen very often, but it does happen with both adults and children. It's kind of rare with children, but it does occur. Typically, some of these children could be tested positive for COVID up to 56 days after the initial diagnosis. and some of them have extended periods of insomnia. Insomnia seems to be the most common cause. Around 18% of the children get insomnia. They can't sleep well. Some of them have respiratory symptoms. That's approximately 15%, where they get chest pain and tightness. Some of them get nasal congestion, fatigue, muscle and joint pain, which is kind of common, and concentration difficulties. So they don't know exactly why some children get long COVID, and they also, for the same reason, they don't know why some adults get long COVID. But typically the symptoms can last for a long period of time, and the children and the adults, they have to suffer through it. So this is a common term. It's called long COVID, and they sometimes call this long haul COVID. So it all depends, but that's a little bit more about this. So let's talk a little bit about the management strategies in children and adolescents with mild to moderate COVID-19. I don't want to speak much about this because I know my partners and colleagues have spent a significant amount of time speaking about the details of this, but I just wanted to go over some of the things that are more relevant to the adolescents and child group. The most important thing you could probably do is get a vaccination. Vaccination in children is being more and more accepted. It is recommended for all eligible children who are greater than 5 years of age. They could also get a booster vaccination for those who are greater than 12 years of age. The key point to this is vaccination demonstrates effectiveness against acute COVID and its complications, including multi-system inflammatory syndrome in children, which I mentioned earlier. So one of the key factors here is to get your child vaccinated. I know there's a lot of parents who feel that this is not the right thing to do, but all the evidence, and we have so much time that we used vaccines already. I mean, we've been using vaccines for a couple of years already, and they've shown minimal side effects. So all the evidence is pointing to, if you want to protect your child, get them vaccinated. And it works for so many different new variants because it'll decrease the likelihood of a severe infection. Now, if your child happens to get sick, and I'm going to talk to you about a couple of management strategies. Beginning January 1st, 2022, we came across the Omicron variant. And also we have the subvariant, which is known as the BA.1.1. These have become the most prominent viruses in the United States. So the idea that's being promoted is that the National Institute of Health recommended a couple of treatments if the patient goes into severe COVID. And one of those is remdesivir. Remdesivir has been approved by the FDA for the treatment of COVID-19 in adult and pediatric patients who are greater than the ages of 12 and they weigh more than 40 kilograms. There's another medication that's being under investigation, and I hope I don't butcher the word. It's called Bebtelovimab, and this new medication has been shown to be quite effective for mild to moderate coronavirus disease. This is included for people who have the disease, who are showing signs and symptoms. And again, this is promoted for ages 12 and over and those who are weighing over 40 kilograms. So we have a couple of FDA-approved drugs that are on the market. How effective they are, I'm not going to get into the details about that, but they are both recommended by the National Institute of Health, and this is something you may want to keep in your back pocket, God forbid you have to treat a child with COVID. Regarding standard management treatment for a patient who, if they ended up being in a hospital, it seems like oxygen therapy is the key way to treat these patients, and the high-flow nasal cannulas become the go-to high-flow device to use on these children. Also, The COVID-19 treatment guideline panel recommends the use of dexamethasone for hospitalized children. They could also use non-invasive ventilation. And if cases go into severe respiratory failure, you might have to consider mechanical ventilation and ECMO for these particular patients. My partners have done a great job of explaining all of these modalities. I just wanted to give you an overall idea of how to manage a pediatric patient. So I'm going to ask you, of everyone in this group, if any of you have children between the ages of 5 and 18, how many of you had your children get the vaccine? Just in the response in the Q&A, just write down, yes, my child is vaccinated, no, my child is not vaccinated. This way I have a good idea of what goes on amongst ourselves. So the number one reason why people don't get vaccine for children is because of the message that throughout this whole pandemic, there's been evidence to show that children are mildly affected by the virus. In other words, they're asymptomatic or they have mild cases of COVID. But as you see in this presentation, that's not always the case. The Omicron wave has been getting more kids sick, and then more kids are being hospitalized with the Omicron wave than before. Most of those children, if not all of them, are unvaccinated. And then I also spoke to you about the long-term consequences of getting COVID for children, long-term COVID or long COVID, as I was mentioning before. Remember, COVID-19 can sicken people of all ages. So if you get the virus, you get the virus. A child is just as susceptible to getting the virus, but they actually predictably have less severe cases. And we mentioned a little bit about the ACE2 receptor sites in the lung. Now, among the children who are under 18 years of age in the United States who have gotten the COVID vaccine, that's great news. But we just have to mention that tens of thousands of patients, children, have been hospitalized. Children have died in the hospital as a result of COVID. Even if your child doesn't get very sick, they can cause an infection in a family member. For example, someone like your grandparent or someone in your family, someone that has comorbidities. So these vaccines have been shown to be highly effective. They work very well at preventing severe illness. They prevent hospitalizations, and they prevent death. So the point is this. There's enough evidence out there to show that the vaccines really have a safe profile. There's enough evidence out there to show that most of the hospitalized patients we have today are unvaccinated. So, you know, and it behooves you to get your child vaccinated. And as I mentioned, many children are getting sick. Many children are getting what is known as long COVID. So you really got to protect your family. And more importantly, and I don't know if this is more importantly, you want to protect your family members, people within the family who could get sick from a child and potentially die. And this is what you want to prevent. So in my opinion, if I had a child within that age group, I would absolutely get them vaccinated. Personally, my children are all older now, and they are all vaccinated. So as of April 6, 2022, this is what the CDC reported in regard to children who received vaccinations in this country, in the United States, who are at age 5 and greater, up to the age of 17. As of this point, 9.7 million children between the ages of 5 and 11 received exactly one dose of the COVID vaccine, representing approximately 34% of the group. Another 7.8 million children of that age group, 5 to 11, completed the second dose, representing 28%. 17 million children ages 12 to 17 received at least one dose of the COVID vaccine, representing about 68%. and then 14.5 million children ages 12 to 17 completed the second dose, representing about 58%. So as you could see, it is starting to gain a little traction in this country that children are getting vaccinated, and that's a good thing for all the reasons I mentioned earlier. And these are some of the most current stats I have as of April 6, 2022. I'm sure it's going to get a little bit better as time goes on. So currently, as of me presenting this PowerPoint, there is approximately 18 million children from ages 6 months to 4 years of age in the United States. And currently, none of them are vaccinated. Clinical trials are underway about children under 5 getting vaccines. I know that Pfizer has been doing some research, but vaccines have been approved from ages 5 to 11 and also from 12 and older up to 18 years of age. And we're going to get a little bit more into vaccines a little bit later, but currently the evidence doesn't support giving those children who are 4 years of age and younger a vaccine because they're actually conducting clinical trials right now. So I don't have a type of any kind of information to tell you right now on that topic. So let's talk about the most common side effects or reactions you get from a COVID vaccine in children. And basically, most reactions are reported a day after both doses. In other words, the day of your dose, you really don't feel anything. It's day 2 that you start feeling a little something. The most frequent reported reaction from either dose is injection site pain. And that's exactly what I felt. When I got my COVID vaccine, I got the first one, the second one, and I got one booster. I felt definitely some injection site pain the next day. Did I feel fatigue or headache? No. Did I feel any other kind of symptoms? No. But the most common reported symptoms is either injection site pain, fatigue, or headache. Fever was more frequently reported after the second dose than the first dose. They said during the second dose, it was approximately 13.4% of the people reported some kind of fever. And on the first dose, it was like 7.9%. So I think the bigger impact comes on the second dose. Like I said, with me, I really only had injection site pain. I really didn't have a fever. I didn't really feel fatigue or any kind of headache or anything from the dose, but everyone can be a little different how they respond to it. As healthcare workers, we are in a very good position to help parents understand the need for vaccination with their children. We work at the bedside, we work in the hospital, we've seen patients who have COVID. I speak to a lot of respiratory therapists who tell me that most of the patients they have in the hospital are unvaccinated. Now that we know a little bit more about the consequences of not getting a vaccine, we should be a spokesperson for the parents. We should be able to help them with some questions. So one of the key considerations, we should be able to answer questions posed by parents. Parents have concerns. They worry about the side effects. They worry about, does my child really need it? What about herd immunity? My child doesn't need it. I'm going to just put them on a mask. You should fill them in with questions and let them understand there is a term called long haul COVID, and there is consequences of not getting the vaccine. Also, you got to emphasize with the patient. Basically, parents, you can't come across as a Mr. Know-it-all or Mr. or Mrs. Know-it-all. You need to sort of emphasize from their point and say, listen, I have children, or at least my brother has children, or my sister has children. You got to emphasize with them exactly what's going on, and you should be able to put yourself in their shoes and talk to them in the right way to convince them appropriately. Also, you got to be there to explore concerns. Some people want to know about side effects. Some people want to know, is Moderna better than Pfizer, or about Johnson & Johnson? People want to know about long-term effects of vaccines. And there are people who don't get the influenza vaccine that you'll never convince. There are people out there who are parents, who are, people out there. They will never get the vaccine. They will not get the influenza vaccine. They are just against vaccines, against. But, you should explore the concerns. Sometimes you need to get permission from the parent to share information, what you know about COVID. In other words, you'll listen to their concerns, you'll be a great listener, but then this comes to a point and say, listen, I could offer you some information. Do you want to hear what it? So basically, get permission from them and to explore why it would be good for them to get the vaccine. And then finally, you could sometimes pose questions to them and ask them, what reason would you give for getting your child vaccinated? What reason would you get for getting yourself vaccinated, or your dad vaccinated, or your mom, or your wife, or your husband? So, these are the things you got to do. I mean, the point of this, there's a way of sharing information with people based upon your knowledge on a topic that you could help them in the long run. In summary, it's an individual's choice for a parent to get their child vaccinated. Each parent makes their own decision. They weigh the pros and cons, but as time goes on and the evidence comes out more and more that the side effects from the vaccine are less and less, that maybe it's a smart thing to do. Evidence has shown that children are less prone to get severely ill from a COVID virus if they got the vaccine on board, and they could actually help people within their own community and their own home. You should know the science behind vaccines. You should understand how vaccines work, that, an mRNA vaccine doesn't change your DNA. You're not screwed for life. People should understand the science behind vaccines. You should also explore the consequences of having no vaccine. So if you don't have a vaccine, the likelihood of you getting long haul COVID, the likelihood of you being hospitalized, the likelihood of you being severely ill, the likelihood of you transmitting the virus to someone else is really very real. And if you don't know all the answers, seek the help of experts. There are plenty of people out there. There's plenty of stuff on the internet to understand how it works. And I hope you enjoyed this presentation. This is a short list of references. I had many more when I put this presentation together. So if you're interested in more references, I'll be more than happy to share with you. But I believe the references here would definitely put you on the right track to understand if you're looking to explore more about COVID. And I thank you, and you have a great day.